Hey guys, today we'll be covering the last topic for the pre-malignant lesions, actinic cheilitis. It is a pre-malignant alteration of the lower lip vermillion, and it almost doubles the risk for developing a malignancy, that is, the squamous cell carcinoma. It usually results from chronic UV light exposure. Now, when talking about actinic cheilitis, there are some risk factors which contribute to the disease process. Middle-aged to elderly people are most commonly affected. Males are 10 times more affected than females. Fair complexion, outdoor occupations like farmers, construction workers, lifeguards, and sailors. Albinism, immunosuppression, and tobacco smoking. Now, when we talk about immunosuppression, in this, the malignant cells are not recognized and destroyed at an early stage. Now, let's look at some of the clinical features that the actinic cheilitis shows. The lesion develops slowly over years. It appears as atrophy, dryness, and fissuring of the lower lip vermillion. The lower lip vermillion is basically an area which is just adjacent to the skin. The atrophy appears as a smooth, blotchy, pale area, and the reason for this will be discussed in the histopathological section. We will also witness blurring of the margin between the vermillion and the skin. Now, as the lesion progresses, we will see that it becomes more rough and scaly. Eventually, we may also witness a leukoplekic lesion. Chronic ulcerations develop and they last for about days, weeks to months. Ulcerated lesions, they progress to form a malignancy. Now, let's move on and discuss the pathogenesis. As we all know that the sunlight releases UVA and UVB. This leads to ionization of the epithelial cells. This ionization causes a release of hydroxyl ions and the oxygen radicals. These eventually lead to a DNA damage. Now, in most of the studies, it is known that the UVB causes mutation in the epithelial p53 tumor suppressor genes. This causes an interruption in the cell cycle. Now, when the cell cycle is interrupted, it causes an initiation of the genetic alteration of the epithelial cells. Now, this alteration will eventually lead to uncontrolled cell proliferation. Now, moving on, let's discuss the histopathological features. First of all, we will see that there is mild to moderate dysplasia, and that, again, is shown by an increased nuclear to cytoplasmic ratio. There will be hyperchromatic nuclei, meaning a darkly stained nuclei, and there will be an increase in the mitotic activity of the cells. This is the normal epithelium, and in this we can appreciate the rete ridges. Now, in case of actinic cheilitis, these rete ridges are going to be lost because there is going to be an increased number of cells in the spinous layer, so that causes flattening out of these rete ridges. The epithelium is going to be ectotic, meaning an increased cellularity of the epithelium, just like we discussed before. The picture also shows us the same phenomena. The keratin layer may be either hyperkeratotic, meaning the keratin layer will be more, or it may be atrophic, meaning that there will be a decrease in the keratin layer. Now, the main reason for this is that all of the level of keratin production depends on the level of damage of the epithelial cells. So if the damage is more, it is going to be atrophic, and if it is less, it's going to be hypertrophic. Now, let's go on and discuss the treatment options. First of all, we need to advise the patient to carry out photoprotection to prevent any further damage. Basically, to reduce the sun exposure, wear a wide-brimmed hat, use sunscreen. Now, a surgical procedure known as vermillionectomy, also known as the lip shave procedure. The vermilion mucosa is basically surgically excised, and either the intraoral mucosa is pulled forward or it is allowed to heal by secondary intention. Now, this specimen is given to the lab to carry out biopsy to rule out any malignancy. This procedure usually has a low chance of reoccurrence. Some of the adverse effects include pain, delayed healing, infection, and scarring. We may also see edema, paresthesia of the lip, and this procedure is slightly cosmetically disfiguring. Now, we can also use laser ablation as a non-surgical intervention to excise the lesion. Carbon dioxide or erbium YAG may be used. Its adverse effects include pain and hypertrophic scarring. Now, the next treatment option is phototherapy. In this, light therapy is used at an increased intensity, which releases reactive oxygen species. Now, these reactive oxygen species destroy the damaged cells. Adverse effects include pain, and there is a high chance of reoccurrence. Next is cryotherapy. In this, extremely cold temperatures are used to target the damaged cells. Liquid nitrogen can be used, and its adverse effects include pain, crusting, scarring, and it is not very effective as compared to other treatments. And lastly, topical treatment. An ointment is applied to the affected area once daily for around 1 to 4 weeks. 5-fluorouracil. Its mechanism of action is that it impairs the DNA replication. Whereas imiquimod, it is an immunostimulator, so it stimulates the immune cells to create an immunity for the body to fight the malignant cells. Its adverse effects includes pain, crusting, and inflammation. So this was all, guys. I hope you enjoyed.